develop human capital. On page 35 and onwards, we deal with the relationship with providers and economic partners. Because assistance organizations for the elderly have an economic impact on all those who provide a service or who provide raw materials to the structures itself. So as economic partner, they contribute to the correct provision of services. Services which are more and more demanded and which are on the rise, because we're talking about a booming sector, a flourishing sector. It is a very important market which has positive impacts on jobs and employment. And it is very important to choose one's own provider, and the choice of provider is a determining factor for the quality of the services provided. The social report also focuses on responsibility in the relationships with the public administration. This is a requirement imposed by the law, but it is also important to promote dialogue, because in many national systems a positive dialogue with national institutions means also a positive exchange, a mutual assistance relationship. So we have a form of shared responsibility, because care to older people is a publicly useful service, and institutions play a vital role. And this dialogue is also contemplated within the social report, and we have tried to do that on page 37 by including some specific indicators. And the social report has also to give information about the relationship with the community, the local community, because all the home care organizations are rooted in a specific community. The older people are welcomed, are assisted within the infrastructures, but it is important to have a dialogue with the families. And it is important to really cultivate this relationship with the local community. This is obvious. These organizations have a clear responsibility towards citizenship. And this concept of citizenship has to be enshrined within the social report, because we know very well how communities intervene, how they contribute to the activities and functions of these structures in terms of education, healthcare provision, culture, research, etc., and also in terms of solidarity. To conclude, we have a section dedicated to environment. As I said before, environment is not that relevant because home care organizations do not really have an impact on the environment. But we know that some of these structures are located in beautiful contexts. They're surrounded by beautiful landscapes. Very often they can play a role in enhancing the local territory, the local landscape, and they do that in a responsible way, because environmental enhancement is part and parcel of the service provided to their guests, and it is also part and parcel of the role that they have to play towards the society. So measuring their environmental impact is also an important aspect which has been taken into account by ECHO. And to conclude, the third part of our guidelines provide very specific and operational indications as to the process of reporting itself. So how do you draw up a social report? Well, a social report requires different steps, different stages. It is also an act of courage nowadays, because you really take up your responsibility and you're willing to measure your results in a transparent way. Then it is also very important to define the limits of the social report, its scope, and then you can start collecting the data, defining the contents, and getting approval. And maybe get these contents double-checked by a third party that should certify that the process has been thoroughly followed. And then, of course, the nicest step is communication, dissemination, but it is quite a delicate step, because a home care organization, when it presents a social report, it automatically opens a dialogue with all the stakeholders, particularly with the guests and with the institutions. It does it deliberately, and it tries, of course, to make the most out of it and get most advantages out of it. I would like to conclude my speech by quoting Einstein. Not everything that counts can be counted, and not everything that can be counted counts. Well, it was really true, because we have to try to understand that through social reporting there are figures and data that are not relevant, that do not mean anything, but there are other values that cannot be quantified but which really make the difference. Thank you.
Adesso la parola all'onorevole Balduzzi. Grazie.
Thank you for your invitation. I'm glad to have accepted the invitation of the chairman, Mr. De Santis, but also the chairman, Mr. Anaste, of the two Italian regions, Piedmont and Liguria. Well, what is presented today has a meaning that goes beyond the specificities of our sector, the assistances in healthcare in general for the elderly. Well, today we are between two sectors, which are the assistance in general and the healthcare sector. So what has been shared by our colleagues and also specifically by Mr. Luison can be read in two ways. First of all, we have to understand that the healthcare, the assistance sector can be measured as other sectors. And then secondly, when we say this, we also recognize through these proposals, we go further the basic health sector. Well, I would like to focus on these two key elements. First of all, of course, I'm influenced by the Italian experience, of course. But in this field, the Italian experience is completely in line with the other experiences. So I think it can be useful to share our experience here with you all. So we know that concerning the social health sector, the assistance sector, we are far, far away. We're far from having an analogy with the strictly health sector. In Italy, the essential levels of assistance in the health sector are have existed for the last 13 years. When we talk about social assistance, well, we're still waiting for something specific. So, concerning the results of the health system in Italy, as in other member states, we have a consolidated program of evaluation of the results, but almost always it stops at the hospitals. It doesn't go beyond the territorial health assistance, but not even in the social health, in the assistance sector. So during my experience as a minister, I have been able to, well, you know how it works in Italy, it's quite long, so it hasn't seen an end, but anyway, the text is there. So it's a regulation on the hospital standards that has been developed. So it's quite advanced, and it focuses on the volumes of activity and what is necessary in the sector and the territory, what are the specificities from a surgery point of view, but also the employees, the health assistants, the administration. There are many, many indicators that are taken into account. But of course, as I said, we're far from having everything in the social health and the assistance sector. And there's another element. There are many elements that can be considered as an instrument that can control what has been done. There are many indicators that have still to be developed in the assistance sector, but in this context, the social reporting is the perfect occasion to learn what is done and go forward. So I think in this context, these guidelines are important, and they underline many elements that are also fundamental, so that we can really learn from each other and inform the institutions. It's important also to underline the role of the communication of this information to all the stakeholders. So this is a way to have a higher level of participation, of course, according to the disabilities and according to their level of independency. People can participate at different levels, but this allows them to participate nonetheless. So very interesting what you said about sustainability, because it's a question of trust, and without trust there's no sustainability whatsoever. So this is the first element, but then there's another one, as I said, which is that these guidelines go beyond what are the standards that exist in the health sector. And correct me if I'm wrong, at some levels it's also a question of society standards in general, because here we are talking about segments and typologies of companies that until now, well, they're not really interested by this obligation of social reporting. So I really think that this is another reason why it's fundamental, because this acquis, these elements also have to be taken into account in the strictly in the health center. All the sanitary, all the health structures should respect these guidelines, and this would be really positive for all the sectors. Only also the health sector, not only the assistance one. Of course, my experience is focusing on Italy and some specific regions. Some